I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Audrey Guth this morning. She's joining us to talk about the Nanny Angel Network and her being awarded Astellas Oncology's 2019 C3 Prize. Welcome to the program, Audrey Guth, and thank you so much for taking the time.
Neil, thank you so much for having me this morning, and I am so honored to be the recipient of the Astellas Oncology C3 Prize for the work that we do with the Nanny Angel Network. When I was diagnosed with cancer and in treatment, I was sitting in a waiting room waiting for my treatment, and next to me was a young mom. She had a toddler who was climbing up and down her with like a jungle gym, and I just saw this young mom she was so frail and pale, and her cheeks were sunken, and tears started rolling down her cheeks as this child pulled the scarf off her bald head. And that's when I had my aha moment, and I thought, I can help this mom. I'm the owner of a nanny agency, and who could use help more than this mom? So that's really how it started. We've been in existence for about 10 years, but with the Astellas Oncology Prize, it's not about how long you've been functioning. It's about an idea, and no idea is too simple. It's what the impact of that idea can be to be able to support everyday challenges in cancer care and to bring solutions to those challenges facing people impacted by cancer.
How did you hear about the C3 Prize?
I was sent a link by a friend of mine in Atlanta. We're in Toronto, and this is a worldwide prize. So we were competing with people from all over the world, and I was a little bit intimidated initially, but the process was so simple. And I guess when you think about child care and moms who have cancer, it's so simple. You know, it's such a simple solution, and yet it was a problem that nobody was tackling. And when I realized that, you know, moms are the caregivers of everyone, and when we need help, we don't have that support. So by giving moms the opportunity to not have to take their children to treatment, to know that their kids are going to be okay, is really a simple concept that the Astellas C3 Prize judges recognize that would be hugely impactful, that moms should never, ever have to choose between their own care and taking care of their children.
Did you consult with mothers before applying for the prize to get a feel for what was the most needed?
As the owner of a nanny agency and as a mom of 4 children and as a mom who had gone through cancer, the first thing that goes through your mind when you hear those words, you have cancer, is what about my children? How am I going to take care of my children? Are my children going to be okay? So from a personal perspective, I really had a good handle on what mothers needed. During COVID, of course, moms, are already, they're immunocompromised, they're already isolated. Can you imagine, what this is like, having a pandemic and having to deal with cancer, and then all of a sudden having your children at home?
I can't imagine.
The C3 Prize was, although initially we had helped us, it's just unimaginable. And when you think about, originally the C3 Prize helped us build our backstage technology. It helped us develop a learning management system that we could train volunteers so that we could expand this network. And it helped us develop a CRM, client management system that we could handle our volunteers and match our volunteers to our families. But when COVID hit, we were in a unique position because we had this amazing support from the Astellas C3 Prize that we were able to, and were nimble enough to answer the situation. And what we realized was, that what the moms were most worried about were their children. And what was one of the most difficult things is giving their children nutritious meals when they were afraid to go out. So as a result, we've been able to provide cooked meals through caterers to over 6,000 meals so far. So it's been really terrific for us.
Wow. We're in the middle of this decision. Do we go back to school? Do we go virtually? Do we go in person? Do we mix those two? How are mothers who have children, these mothers are already dealing with cancer, as you say, some of them afraid to go out. You're providing, a service for them with the meals. But what about this huge thing of going back to school, if at all?
It's a challenge for us because we're an in-home care agency, and when COVID hit, we had to, we couldn't actually physically go into the home. So we did virtual visits. We created a homework club so that volunteers could support kids through helping them with their homework, which we will continue to do once school starts again. And we really hope that with some COVID-appropriate training, our volunteers will be able to go back in the home and support these moms, because it is a huge challenge to be able to get well and to rest and recover when you have to homeschool your children, when you have to worry about preparing meals, when you can't go out. And so I really don't know. We're all in the same boat where we don't know what's going to happen when everybody goes back to school.
Astellas Oncology's 5th annual C3 Prize, they've launched and they're accepting applications now through September the 28th. What would you say to the applicants who are currently seeking this prize for some of their ideas that go beyond the medical treatment for cancer?
For anyone even thinking about making a difference, for caregivers and for individuals undergoing a cancer journey, even no matter how simple the concept is. And think about the concept of childcare. It's such a simple concept, and yet such a necessary thing to be able to help moms get well and be the moms that they want to be. So if we were able to compete on an international scale and win this award, which is up to $200,000 worth of support, both financial and otherwise, then no idea is too small. And it doesn't have to be technology-based. But we certainly are not technology-based. We're support-based. So it doesn't have to be a developed idea. It just has to be a concept that can have the most incredible impact on this community and people facing and impacted by cancer.
Where can our listeners go and learn more and apply for the C3 Prize up until September the 28th?
So it's very simple. You go online. The application process is really simple, too. And it's just c3prize.com. Put your idea to paper and see what happens, because we certainly didn't expect to be able to share all of our learnings and our experience on a worldwide scale through Astellas, and it's been absolutely amazing for us.
And once again, that website is www.c3prize.com. Audrey, it's been an absolute pleasure speaking with you this morning.
Thank you so much. I really appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Audrey Guth, cancer survivor, mother of 4, and the head of the Nanny Angel Network in Canada. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.